Cold and lacking the attributes needed to be a nurse. That was how Lucy Letby was described when she failed her final student placement. In this video, I'm going to be taking you through a recently released document showing you exactly that, and also discuss what was mentioned in a recent BBC article regarding Lucy Letby's failures as a nurse. Take a listen to the following. Final report for Lucy Letby, dated the 7th of the 8th, 2011. Since the midpoint interview, Lucy has worked hard to address the areas of concern highlighted by myself and observed by colleagues at that point. In many areas, Lucy has shown improvement. However, I still have concern regarding Lucy's lack of or insufficient consistent progress in others. Lucy's confidence has obviously increased throughout the placement, and she shows this in the way she interacts and communicates with nursing staff and also children and families. However, this is not yet consistent, and at times Lucy does not keep nursing staff fully informed of her ongoing care planning and delivery. This means nursing guidelines are not always followed, and she is not always able to recognise when change in care practice is necessary. This has been evident on a number of occasions when Lucy has shown a lack of awareness of medical, surgical and the required care, e.g. child with HP, HI pre-post-op CSM checks and the correct skills for assessing frequency of pre- and post-op observations, pre-op care planning checklist, deviation from #FEMA guidelines. Lucy doesn't seem to always recognise her limitations and when to ask for clarification. She also shows limited capacity for reflective practice and the necessary change in practice this should facilitate. Lucy does display more confident communication skills with children and families and does show increased knowledge when answering some questions and reassuring parents. This does need to be more consistent, as Lucy can also display limited communication skills when dealing with unexpected situations. She needs more experience at observing and picking up on non-verbal signs of anxiety, distress from parents, and recognising when to change her approach. E.g., child with developmental delay and SaO2 monitoring, Lucy did recognise the importance of obtaining a baseline SaO2, but a member of staff had to step in as child and family were increasingly distressed. Lucy should have initiated distraction techniques and involved a play specialist to help alleviate the anxiety. Lucy is becoming more confident liaising with other members of the MDT and is putting herself in situations where she has to discuss or inform medical staff of progress or problems. It is encouraging that Lucy is taking on this role, even though I'm aware she isn't completely comfortable. Lucy has been practicing her delegation skills but reports herself that she finds this difficult. Lucy does have to be actively encouraged and prompted to do this regularly to enable her to effectively prioritise care. She does follow up on delegated tasks to ensure compliance. We have had a number of discussions during this placement over the way Lucy absorbs and demonstrates her knowledge base and skills. Lucy reports that she needs time to absorb questions and process her answers with regards to medical surgical knowledge and medicine management. Lucy is aware of my concerns that on an acute children's unit this can be restrictive and unsafe when some situations and potentially life-threatening episodes can occur. Although I know that this kind of quick thinking and ability to reassess conditions and care in emergency situations does come with experience and time, a sufficient level of knowledge of medical surgical conditions, care required, and the ability to process medicine management would help support this. It is evident that Lucy has worked hard to improve in these areas, although it is not yet consistent, and a theory-practice gap still exists that is not at the required standard of an entry-level nurse. Lucy's lack of confidence when communicating with nursing colleagues is also evident when the opportunity to attain new skills arises. Lucy has looked after patients with IVIs and NGT and needs to verbalise an interest in enhancing her practical skills. Over the past few weeks, we've had a number of patients requiring practical skills such as gastrostomy feeds, tracheostomy care, CVL care, feeding pumps and dressing changes that Lucy could have developed. Perhaps the maximum opportunity wasn't taken as far as I observed. Lucy has worked hard to improve her knowledge of some of the more basic common conditions nursed on the unit and at times can show this when questioned and through her care planning. However, some areas need a lot of prompting and encouragement to arrive at the correct answer. On occasions I've observed when Lucy wasn't working with me that Lucy has looked after patients whose condition Lucy knows very little about. My worry is not that Lucy has not encountered that condition necessarily, but that Lucy did not identify the importance, significance and potential consequence of caring for that child safely and competently, without basic understanding of condition, care planning, assessment, delivery and re-evaluation of deterioration cannot happen. You are also unable to support that family child adequately if you have insufficient knowledge. This has been addressed, but Lucy does at times continue to nurse patients before clarifying her understanding, e.g. child with complex needs CSM checks. Lucy actively seeks to read guidelines when made aware of them, but appears to find it difficult to retain the information learnt when questioned by myself and other staff members, e.g. care of FEMA, neurovascular observations, pre-post-op care and medications. Lucy does demonstrate drug calculations on a regular basis, but does seem to find it hard to retain information about side effects and drug uses for common drugs we have given over the last few weeks. This has been observed by other colleagues also. Lucy does, however, check the BNF to confirm or find out this information, which obviously demonstrates safe medicine management and initiative. Lucy has had to be reminded of the NMC guidance when ensuring that regular medications are given and omission reason is documented, and the necessity for ensuring drugs are administered correctly and timely by 2 qualified nurses. Lucy does display use of initiative at times when recognising when to clarify or ask for help. This is not consistent and is very variable. We have discussed the significance of not only being able to recognise when to question, but the importance in trying to problem solve and use initiative to determine possible options. I have suggested when Lucy is unsure of anything that she checks local policy guidelines, pathways and reference books to problem solve rather than just expect an answer, which Lucy does do. On other occasions, Lucy needs to refer to more basic information such as previous feed fluid balance charts and patient care plans rather than asking staff. We now move on to an incident which was described at the public inquiry just yesterday regarding Lucy Letby giving 10 times the prescribed dose of morphine in error. Take a listen to the following. Now, this is from an article taken from the BBC. Lucy Letby gave a baby 10 times the prescribed dose of morphine in error 2 years before her killing spree began, a public inquiry has heard. The Thirlwell inquiry, which is examining how she was able to kill and attack babies between June 2015 and June 2016, heard Letby received extra training after the incident. Yvonne Farmer, who was practice development nurse at the time, told the inquiry at Liverpool Town Hall it was a, quote, very serious error. The mistake was spotted quickly and the baby suffered no ill effects, the inquiry heard. Miss Farmer said Letby was not far into her nursing career at the time, but was outside the period of supervision required by the Nursing and Midwifery Council. Part of the hospital's response to the incident was to make Letby have extra training with Miss Farmer. She said, quote, Lucy Letby was unhappy that she had to refrain from administering controlled drugs for a period of time. When asked if it was normal for a nurse to be unhappy about not administering controlled drugs in those circumstances, Miss Farmer replied, maybe not. My word, just when you thought that this case couldn't throw up any more surprises. So not only do we have Lucy Letby being pretty much a terrible nurse to begin with, but we also have her administering 10 times the amount of morphine, quote unquote, by accident. Was it an accident? Probably not. And we also have another incident mentioned in this article from April 2016, where Letby gave antibiotics to a baby that had not been prescribed them. So you've got her giving 10 times the amount of morphine that she should have gave, and also giving a baby who had not been prescribed them antibiotics. I mean, this was a car crash waiting to happen, surely. I mean, so many people who are supporting Lucy Letby will say, oh, she was a persecuted individual, she was a fantastic nurse. She was an absolute shambles, let's be honest. Now, I also wonder if this factors in to what she actually wrote on those post-it notes. I'm not good enough to care for them. I'm not good enough. I'm an evil person. As I say, a very small section of people will try and convince you that really she wrote that down because she was a persecuted individual. Everyone was against her. She was bullied. She was picked on. She was being accused of things that she hadn't done. But quite clearly here, this was an individual who wasn't up to the mark to begin with. She was someone who had, in some ways, a superiority complex, complaining about other individuals, the Band 4 nurses. Oh, what are they doing? They can't do this, they can't do that. Well, I'm sorry, Lucy, but you can't even administer medication correctly, can you? Let's be honest. I mean, was that intentional? Was this simply a mistake? Was this someone who wasn't really that interested in being a nurse and had ulterior motives? I guess that remains to be seen. Let me know some of your thoughts down in the comment section below.